Joining us now, Secretary David Shulkin, the former Veterans Affairs Secretary under President Trump, and CNN medical analyst Dr. Rochelle Walensky. She's the chief of infectious disease at Massachusetts General. Dr. Walensky, the president is continuing to hold these huge rallies across the country after getting the virus himself. And we're hearing that his Minnesota rallies last month are now being blamed for more than a dozen COVID infections. What do you think of him not taking all of this as seriously as he clearly should, and possibly exposing so many people to what is potentially, at least, a very deadly disease?
Good evening, Wolf. You know, there's now a long track record of rallies that have led to infection. So we know after the Tulsa rally in Oklahoma, cases went up sixfold in Oklahoma. We know after the South Dakota motorcycle rally, there were 400 cases attributed to that rally. We know after the Rose Garden, 34 cases attributed to that event. And of course, what you just mentioned with Minnesota. What concerns me most about the Wisconsin rally is that there's a swarm of COVID there right now. The case rates in Wisconsin, the positivity rates are an astounding 24%. So we know that people in that rally are unknowingly carrying COVID, and they're just going to leave a massive wake of COVID after that rally. And I would just say, if you're sitting in an emergency department physician in Wisconsin, you can just anticipate an oncoming train.
Yeah, that means for every 100 people tested, 24 of them test positive. That's so scary indeed. Dr. Shulkin, the president rallying today in Michigan and Wisconsin. These are two of 10 states that are now seeing surges in new infections. We're clearly not where Dr. Fauci had hoped we would all be going into the fall and winter. So what are your greatest concerns right now when you see what's going on?
Well, Wolf, I don't think any of us are where we believe that we should be, and all of us are very concerned about what the projections are showing. In just 3 weeks, the CDC says that we could be having up to 6,700 new hospitalizations each and every day. And of course, that has the real possibility of overwhelming our healthcare system. And it's not just the beds that may not be available. Our healthcare professionals, our doctors and nurses, are working overtime, and certainly their shortages are going to be severe. So these projections and the number of new cases that we're seeing, in my career, I don't think that we've seen a health crisis like this before.
And it's getting worse by the day, Dr. Walensky, despite what the president says when he says it's disappearing or we're rounding the curve or whatever. He says, if you take a look at this, maybe we got a graphic I could put up on the screen. But look at this past week alone. On Monday, 41,000 confirmed coronavirus cases. Tuesday, 52,000. Wednesday, 59,000. Thursday, 63,000. Friday, 69,000 new cases. It's going in the wrong direction big time, Dr. Walensky, as you can see from this graphic.
And it's escalating fast. I mean, we've gone tens of thousands new cases in just a week. You know, Dr. Fauci warned us that we may very well get to 100,000 new cases, and I suspect that we will, because we're not doing anything to mitigate this, right? I also worry that, you know, what we see today is increases in cases, and they continue to increase. What we see 2 weeks from now is escalating deaths.
Yeah, that's so scary indeed. You know, Dr. Shulkin, Dr. Fauci has called gatherings, potential gatherings, let's say for Thanksgiving, a risk right now coming at the end of November. Says he's not getting together even with his own children for Thanksgiving. It's so sad to hear that. Is that what we should all be considering as the holidays approach, given what you've observed so far? Do you think people will actually pay attention to that advice?
Well, I sure hope so, Wolf. What we've seen is we've seen a lot of the spread that's been going on has been happening within families and within small groupings. And as it gets colder, particularly in parts of the country like the Northeast and the Midwest, we are going to see much more indoor activity. And if we don't pay attention to the fact that we know that this virus does spread easily indoors and is spread through an aerosolized mechanism, we're just going to see continued spread. And I think the projections that Dr. Walensky is talking about, that Dr. Fauci is talking about, unfortunately, really are realistic. And if we don't get ahead of this, by Inauguration Day, we could see 350,000 deaths in this country. Just a mind-boggling number. So we better take this real seriously.
Yeah, and almost 70,000 new cases just yesterday. Dr. Walensky, Europe is also seeing a similar spike in new cases. Many areas in Europe are putting curfews. They're targeting lockdowns. They're putting all that in place. Do you think it will come to that again here in the United States?
Well, I think that we need national leadership in order to come up with a cohesive plan as to move forward. I'm very worried about the current plan that the administration seems to be endorsing that looks at herd immunity through infection as a plan. I don't think that's the plan that we should move forward. Herd immunity is a plan that we should get to from vaccination, certainly not from infection, or we can anticipate an extraordinary number of deaths. So I think we need national leadership. I think we need mask wearing. I think we need distancing, and I think we need a cohesive plan. It may be that a lockdown would be necessary again. I hope it wouldn't come to that, and a cohesive plan that people adhere to would sort of hope that we wouldn't need to get to there.
When people hear the phrase herd immunity, Dr. Shulkin, what goes through your mind right now? Because it's been so widely discredited, but I'm anxious to hear your thoughts.
Yeah, listen, this is a term and concept that's just being misused, and all the experts in public health understand that. As Dr. Walensky said, this is a term that really is appropriately used for vaccinations. And when you get above a certain percent of the population that are vaccinated, often 70, 80% of the population, others can receive some type of protection. But this herd immunity was never meant to be used for this type of pandemic with the type of spread that we've seen, where approximately only 10% of the American population so far has been infected. So I completely agree. This is not a plan. This is actually a plan for disaster and a plan to continue this pandemic. And so we have to go back to what the science tells us, what we know works. And it's about time that we test that. And we can avoid a national lockdown if people would start adhering to wearing masks, social distancing, proper hygiene, and respecting this virus.
Dr. Shulkin, thanks so much. Dr. Walensky, thanks to you as well. We're grateful for all your expertise.